Kim, my name is Jen, and I'm going to be conducting your intake assessment. How are you today? Okay. So I see you filled out your paperwork. Thank you for doing that. Just to gather a bit more information about you, what are your preferred pronouns?
She, her.
She, her, okay. Is this your first time coming to treatment at ABC Treatment Facility?
Yeah, it is.
Okay, well, welcome. We're glad you're here. So the assessment today should take between 30 and 45 minutes. Is that okay with you?
That should be fine.
Okie dokie. I'm just going to be asking you several questions throughout the duration of the interview just to get to know you a bit better. But before we jump into it, I've got to mention confidentiality with you. So, as a mandated reporter, the legal requirement to report suspected child or elder abuse supersedes my professional duty to my clients to keep information confidential. In addition, I'm also mandated to report if you are a threat to yourself or a threat to others. Okay? Okay. All right, so let's go ahead and jump right into it then. So, what brings you here today?
Oh my gosh. Well, I've just been like really overwhelmed with anxiety lately. I've kind of had some panic-like symptoms, which I haven't had in a very long time. I just can't focus. I'm anxious all the time, and I feel like it's just getting in the way of things I need to be able to do.
Okay, so to me it sounds like your anxiety and your panic is kind of taking control of your life and affecting your ability to function.
Yeah, exactly.
Okay. So with these symptoms of anxiety, how often are you experiencing them?
Um, every day for sure. Sometimes multiple times a day. It can last hours at a time.
Okay, so multiple times a day for hours at a time. So how is this impacting your daily life?
Uh, Gosh, so many ways. I'm not able to complete my assignments the way I need to. I can't focus. I'm in my last semester of school, and so I've got a lot of big projects that are coming due, and I can't focus on them. I also feel like it's affecting like the work I do with my clients, and I'm not able to give them the attention I need. Um, and I don't know, I'm just not enjoying life lately because I'm just so busy being anxious all the time.
Sounds very overwhelming. Um, I'm really sorry to hear that. So, can you describe for me any past mental health challenges you've had prior to having this overwhelming anxiety related to school and to work?
Yeah, well, I've always had anxiety for as long as I can remember. And I used to have panic symptoms very often. Um, and then I hadn't really experienced them until recently again. But I also used to struggle with like really intense nightmares and like being fearful pretty often. But that's not something I really struggle with anymore.
Okay, well, I'm glad that some of these symptoms have gone away for you. So, have you ever been diagnosed by a professional with any disorders or anything like that?
Yeah, my previous therapist diagnosed me with PTSD and generalized anxiety disorder.
Okay, so GAD and PTSD. So was your therapist treating you for your mental health as far as like medications and things like that goes?
Yeah, I do take medications. I still take them. I take Lexapro and Wellbutrin.
Okay, so she or he prescribed you medications as well as did some talk therapy.
Yes.
Okay. Um, have you ever been hospitalized as a result of your mental health?
No, I haven't.
Okay. This section's going to be about substance abuse. So, do you have a history of substance abuse, or are you currently using?
I mean, I drink occasionally, probably like once or twice a week. Um, Aside from that, I don't currently use anything. I tried weed in the past.
Okay. So, whenever you say you drink a couple times a week, how much do you drink in one sitting?
Maybe like 2 to 3 drinks.
Okay. So, would you describe yourself as more of a social drinker?
Yeah, I probably would.
Okay. So, you're not dependent upon it. It's not affecting your daily life.
Right.
Okay. So, we're going to move on to medical history. So, how would you describe your physical health?
I would say my physical health is pretty good. I need to work out more, but aside from that, I think it's fine.
Okay, great. I'm glad to hear that. I need to work out more myself. Life gets kind of chaotic though, and it's hard to remember that we need to do these things.
Yeah, for sure.
So what I'm hearing is you wish to work out more, but you don't have any chronic conditions that you've been diagnosed with by a doctor.
No, I don't.
Okay. Um, so let's move on to your family. How would you describe your relationship with your family members?
um, I would say overall pretty good. I kind of feel like sometimes my mom and my grandma really rely on me pretty heavily, and that definitely takes a toll on my mental health.
Okay. When you say they rely on you pretty heavily, what do you mean by that?
Um, well, my mom is disabled, and my grandma is her caregiver. Um, I also grew up in poverty, and they're still pretty poor, so I find, them and maybe some other family members too asking me for money pretty often. Um, they kind of rely on me to just like a lot of support and help in general, I guess.
Okay, so would you say that you feel stretched thin because your family does depend on you so much?
Yeah, I do. And like I already go to school full time and I work full time and I feel like, they need so much from me too and I feel like I just can't be everywhere at once. It's really overwhelming.
Yeah, that would be impossible. You're only one person, and that's
Yes.
a lot for one person to have to take on. The school, having your family be so dependent on you for things, as well as working, so you've got a lot on your plate.
Yeah.
Um, so, do any of your family members, I know you said your mom was disabled, do any of your family members have any mental health conditions?
Um, yeah, a lot actually. My my grandpa on my dad's side has schizophrenia, and my grandma on my mom's side has schizoaffective disorder.
Mhm.
My mom struggled with depression some, and then my sister also has bipolar disorder.
Okay, so it seems like you do have a history within your family of some of your family members having some mental health issues.
Yeah.
Um, so, so this relationship with your family, how is it impacting your mental health? We talked about it stretching you thin. Is there any other ways that it's impacting your mental health?
Yeah, I would say it's contributing to a lot of my anxiety actually. With my grandma's schizoaffective disorder, she can be very harsh sometimes. And, between them needing me so much and like her harsh behavior when she's struggling, it really makes me think of myself in a negative way. And I kind of feel like I'm a failure. Um, and then those thoughts only contribute to how anxious I feel. So I would say that the dependence and then also like her mental health struggles kind of affect me. And I feel like because of all the time I spend, helping them and providing them with assistance, I'm not really able to take care of myself the way I need to.
Okay, so it's definitely taking a toll on your mental health as well as your self care. It sounds like.
Oh yeah, I don't even know what self care is at this point.
Oh no. Okay. Yeah, we're gonna have to get you on track with your self care. That's so super important.
Mm-hmm.
So as far as your social life, outside of your family, is your mental health impacting any of your relationships, like with your friends and such, or your ability to be functional outside of your home?
Um, yeah, I have a small friend group, but we're pretty close, and lately I've kind of um, not been reaching out as much. I'm kind of not responding to texts like I normally would. I haven't gone out with them in a while. I just don't feel like I have time. Um, and they're pretty understanding, but like I can definitely tell like it puts a strain on my friendships that I have.
Okay, so everything, the culmination of everything you're going through, with your family, with your grandmother, having schizoaffective disorder, your mom being disabled, you being in school and going to work and having to juggle all of these things. It seems so overwhelming for you. I'm really sorry to hear that. So I know you mentioned you have several close friends, which is great. It's so important to have friendships. They mean so much. So who do you consider to be the biggest part of your support system?
Like one person?
Sure.
Probably my partner.
Okay, so you've got a partner.
Mm-hmm.
Okay. And you and your partner, what's your partner's name?
I'm Stephanie.
Okay, so Stephanie provides a lot of support for you. Okay, that's great. I'm so glad to hear that you have her. Okay, so let's move on and talk about your job as well as your education.
Okay.
So, what is the highest level of education you've achieved so far?
I've got my bachelor's and I'm in my last semester of grad school.
Wow, that's impressive.
Thank you.
It sounds like you've already accomplished so much. You're currently employed. You told me that earlier, and sometimes you feel the anxiety at work. What is your profession?
I'm actually a social worker.
Oh, okay. So you're in social work.
Yeah.
Okay, that takes a special kind of person. Yeah.
Yeah.
That can be very stressful in itself.
Yeah, it is.
So where do you work at? I know you said you're a social worker. Where are you employed?
I work at Park Ridge Medical Center.
Park Ridge Medical Center. Okay, excellent. All right. Let's go ahead and move on to your finances.
Okay.
So, would you consider yourself to be financially stable?
I mean, all my bills get paid, and I'm able to make ends meet. I wouldn't say I live paycheck to paycheck anymore. So, yeah, I don't have a lot of extra money, but that's fine.
Okay, so it sounds like you're getting all your needs met.
Yeah.
Okay. So how much money do you make per year?
I make 50,000.
Okay, 50K. Are you currently in debt?
I have some student loan debt, but other than that, no.
Yeah, student loans, those are definitely expensive.
I know.
So as far as the economy is concerned, the current economy or the economy in the past, if you can think back on that as well, within the U.S., has that contributed to any of your stress?
I definitely think like during COVID, I really struggled. I was working in a hospital at the time and I got my hours cut pretty significantly. I was only able to work like 12 hours a week, so that was definitely a stressful time financially.
Oh, wow. So prior to working the 12 hours a week, were you full time?
Yeah, I was.
Oh, wow. Okay. Wow, that's a lot. That's a huge cut of hours. Yeah, I can see why that would be very stressful for you. All right, so now we're going to move on into the legal part of the interview.
Okay.
So, have you had any involvement at all with the legal system?
I mean, no, other than a few speeding tickets.
Okay. So you don't have a criminal history, just the speeding tickets.
Right.
All right. So, what is your current living situation?
I live with my partner and we have a couple cats.
Okay, awesome. I have cats as well. They're my babies.
Mine too.
What are your cats' names?
Mac and Leo.
Mac and Leo, cute. Okay, so you live with your partner and your cats. Do you feel safe in y'all's home?
Oh yeah, I feel really safe.
Okay, perfect. Excellent. And you feel supported by your partner? You told me earlier that she was one of your biggest supports, so.
Yeah.
Okay, great. So you live in a supportive home. All right. Now, as far as cultural and spiritual considerations go, how would you describe your cultural background?
Well, I'm part of the LGBTQ community, so I think like that subculture has really been important for my life. But I would say that's really the only cultural aspect that I can think of.
Okay, so you're part of the LGBTQ community.
Yeah.
All right. I'm also part of the community, so if that makes you feel more comfortable with me. Are you part of a particular religion?
No, I would probably identify as agnostic.
Agnostic, alrighty. So do any of your beliefs or lack thereof affect your mental health at all?
Um, no, I wouldn't think so.
Okay. All right, let's move on to coping strategies. So, whenever you feel stressed, whenever you feel overwhelmed, how are you how are you able to deal with this? Are you doing anything, taking any proactive steps?
Mm-hmm. I've struggled with that lately, but things that typically help me are like listening to music. I like to go on walks. I like to cuddle my cats. I have like some breathing exercises and stuff that my previous therapist taught me, but I've kind of been struggling to implement those. And I reach out to support if I need it.
Okay, great. I'm glad to hear that you have some outlets to help you kind of cope with life and how stressful it can be at times.
Mm-hmm.
So these methods that you mentioned, do they seem, to work for you as far as to alleviate your anxiety?
Yeah, when I'm able to use them, it's just like lately, I don't know what it is, but when I'm anxious, that just takes over and I can't even like think clearly to implement my skills that I have.
Okay, so your anxiety is kind of taking away from the skills that you already have to kind of help alleviate these symptoms, like your breathing exercises you mentioned earlier that your therapist had suggested.
Yeah.
Do you want to pick those back up?
Yeah, I would love to.
Okay, so that's definitely a goal of yours then. Okay. Um, so let's talk about your strengths. What are your strengths?
Um, hmm. I guess I would say that I'm very motivated. Typically, I'm really motivated when it comes to school and like doing good at my job.
Mm-hmm.
I think I'm a really good friend. I think I'm a really good partner. Um, yeah, and I think I have like a lot of passion too, I guess.
Okay, so you're strong and you're passionate, and you're motivated as well.
Yeah.
Um, so are you using these things as far as taking these strengths that you have and applying them to your schoolwork? Because I feel like that might could be helpful for you.
Yeah, I try to, when I'm struggling with my schoolwork, I try to, remind myself like, hey, look how far you've come. You've done really well. You're gonna keep doing well. You just have to focus. And sometimes that helps, but lately it's just like I can't. I don't know what it is. It's just my anxiety is just taking over.
Okay, so maybe you would like to come up with some new methods to kind of help handle your stress.
Yeah, I'm willing to try anything.
Okay, great. So it seems like you definitely want to be here at treatment and you're motivated to want to try different kinds of treatment for your anxiety and for your panic and all of those things.
Yeah, definitely.
Okay, great. Um, so as far as your treatment goes, the strengths that you mentioned earlier to me, how can we use those during your treatment? How do you want to use them?
Um, Maybe just like if I could have some help, like being prompted to remember like how far I've come and like I think I could really tap into my motivation more um, to get better.
Okay, those are great ideas.
Yeah.
All right, so let's go on to the risk assessment, but I do need to warn you, this section will cover some difficult topics, okay? It's going to include suicidal ideation, self-harm, and harm to others. Um, there's no judgment if you do need to stop during the middle of this section. We'll go ahead and stop, and we'll do this at your pace.
Okay.
So just let me know if we need to do so. Have you ever contemplated suicide?
Um, no, I wouldn't say so.
Okay. Have you ever tried harming somebody else?
No.
Okay. Do you feel that you were able to properly take care of yourself?
Yeah.
Okay. Perfect. Okay, so let's go ahead and talk about the treatment that you're seeking. So what are your goals for treatment? What do you want out of this?
I just want to be able to learn some new coping skills and be able to implement them when I'm struggling. I think that's really like what I need the most right now. I just want to get back to like how things were before when I was able to do my schoolwork and do my work effectively.
Okay, great. Well, you're paving the path forward. It sounds like, and we've got some goals that you've set out for yourself going into this. So
Yeah.
so that's fantastic. So as far as your goals in therapy, how how do we want to achieve these? Do you have like certain goals that you want to set weekly or?
Yeah, I think if I could like learn and practice implementing maybe one new skill a week, I think that's doable. I don't want to give myself too much because I don't want to be unrealistic, I guess. But yeah, if we could start there, then maybe see if the faster pace feels right later on.
Okay, perfect. Well, it sounds like you've got some awesome goals, and we're definitely gonna be here to work on those goals with you. So thank you so much for coming for your intake assessment today. It was so nice to meet you.
Thank you. I really appreciate that.